Are your daily meds secretly affecting your sex life? Look, I know that's a pretty provocative question right out of the gate, but if you take a daily pill to manage a totally routine health condition, you might actually be experiencing some highly intimate side effects that, frankly, no one really talks about. Today, we're going to pull back the curtain and look at the hidden impacts of 3 very common everyday prescriptions. Welcome to this explainer. Our main goal today is to completely destigmatize the conversation around perineal and sexual health, and we're going to do that by doing what we do best, diving straight into the data. We're breaking down the research to show you exactly how certain medications interact with your body's most sensitive systems. The idea here is to give you the knowledge you need to truly take control of your overall wellness. All right, here's our roadmap for today. 1. Statins, good for love. 2. Blood pressure meds and ED. 3. Acne pills and hidden pain. And finally, number 4, managing unwanted side effects. Let's just dive right in. Section 1. Statins, good for love? The surprising boost from cholesterol drugs. So, when you think of your standard run-of-the-mill cholesterol pills, you probably don't immediately associate them with, well, fireworks in the bedroom. But a major meta-analysis, which looked at 11 different randomized controlled trials, highlighted a pretty incredible number, 3.4. Men who had both high cholesterol and erectile dysfunction actually saw their erectile function scores increase by 3.4 points on a standard medical survey when they started taking statins. To put that into perspective, that translates to an almost 24% increase in function. It's a clinically relevant improvement that genuinely surprised a lot of people in the medical community. But it begs the question, right? Why on earth does a cholesterol drug actually help with ED? Well, it all really comes down to endothelial function. You see, an erection is fundamentally a vascular event. It absolutely requires your blood vessels to dilate rapidly and efficiently. And high cholesterol causes plaque buildup, which directly impairs this exact function. What statins do is help clear out that plaque and reduce inflammation, which then allows the inner lining of those blood vessels to relax and dilate properly again. So by supporting your heart and arteries, statins are indirectly supporting the very blood flow necessary for sexual health. Pretty amazing, right? As Dr. John B. Costas points out, for men who already need to control their cholesterol, this may be a fantastic extra benefit. Now, just to be totally clear here, statins absolutely do not replace dedicated ED medications like Viagra or Cialis. They aren't going to work on demand. But here's the thing. Millions of people are prescribed statins and actually end up skipping them just because they don't feel the immediate day-to-day benefits of a lower heart attack risk. Understanding that taking your daily statin could actively improve your intimate life today, well, that may just be the perfect motivation you need to stick to your daily routine. Moving on to Section 2, blood pressure meds and ED, how the wrong pill compounds the problem. Okay, so not all cardiovascular drugs are created equal when it comes to your sexual health. If you're struggling with ED while trying to treat high blood pressure, the actual class of pill you're taking matters immensely. Let's do a quick head-to-head comparison. Beta blockers, particularly the older ones, have a surprisingly high risk of causing ED. We're talking 15 to 25% of men taking them. They work by blocking adrenaline, which is great for slowing the heart, but it also blunts the nervous system response needed for arousal. On the flip side, ACE inhibitors have a much cleaner, more neutral profile. The risk of ED with them is incredibly low, under 5%, and that's because they work by directly relaxing the blood vessels rather than dulling that nervous system response. And this brings us to a really critical warning. When guys experience ED from beta blockers, a super common reaction is to just quietly stop taking the medication out of pure frustration. But abandoning your blood pressure meds creates a highly dangerous vicious cycle. Uncontrolled high blood pressure directly damages the endothelial lining of your arteries over time. And remember, those are the exact blood vessels you need to maintain reliable erectile function. By skipping the pill to try and save your sex life in the short term, you might actually be causing permanent vascular damage that basically guarantees ED in the long term. Let's pivot to Section 3, acne pills and hidden pain. The unseen perineal and perigenital side effects of isotretinoin. All right, we are shifting gears from cardiology over to dermatology. Isotretinoin, which you probably know better by brand names like Accutane, is a highly powerful, honestly transformative drug for severe acne. But because it essentially works by hitting your body with massive doses of vitamin A to completely halt oil production, it causes extreme dryness, and that dryness reaches your most intimate areas. Look at these numbers. Up to 17% of patients experience constipation, up to 20% experience anal bleeding, and up to 26% suffer from actual fissures and mucosal erosions. Why does this happen? Well, when you combine a dried out, extremely fragile intestinal tract with constipation, it physically traumatizes the tissue during a bowel movement. It is an incredibly painful and highly taboo side effect that patients are just way too embarrassed to mention to their dermatologists. And sadly, the impact doesn't stop there. It extends right to the perigenital region for both men and women. For women, up to 40% experience vulvovaginal burning, dryness, and painful intercourse. Up to 10% can even develop physical fissures in the vulvar area. For men, erectile dysfunction is the most frequently reported sexual side effect, alongside a profound loss of libido and nocturnal erections. We absolutely have to normalize talking about these startling statistics clinically and objectively. Because think about it, if you don't know the drug is causing this, the psychological toll of suddenly experiencing severe sexual dysfunction or physical genital pain can be absolutely devastating. But there is some good news here. The broader medical community is finally catching up to what patients have been quietly suffering through for years. Major international regulatory bodies are acting on this data. Just recently, Health Canada formally recognized that the link between isotretinoin and the risk of severe sexual dysfunctions cannot be ruled out. And over in the UK, the government has introduced new safety measures that actually require doctors to actively assess and monitor sexual function before and during treatment. The silence around this is finally breaking, which is a massive step forward. Okay, let's bring it all together in Section 4. Managing unwanted side effects. Empowering yourself in the doctor's office. Listen, you should absolutely never have to choose between managing a serious health condition and sacrificing your intimate well-being. If you suspect your daily medication is impacting your intimate health, I want you to follow this really practical, step-by-step approach. Step 1, track your baseline symptoms for 2 weeks. Write down your energy levels, any pain you're feeling, and make notes on your sexual function. Having actual data helps your doctor help you. Step 2, never, ever quit your medication cold turkey. As we learned with those blood pressure meds, the rebound effect can be deeply dangerous. Step 3, bring your tracked data into your doctor's office and explicitly ask about switching drug classes. As we saw earlier, simply moving from something like a beta blocker to an ACE inhibitor can entirely resolve the issue for some people. Remember, small, measured adjustments under the guidance of a physician are what yields the best long-term results. Medicine truly is a marvel, isn't it? But it's also a highly complex web of chemical reactions. What helps your heart might end up hindering your nervous system. What magically clears your skin might dangerously dry out your mucous membranes. It all comes down to understanding the science of your own body. So I want to leave you with this final thought to chew on. What other secrets might your medicine cabinet be hiding from you right now? Stay curious, stay informed, and please never be afraid to have the hard conversations with your doctor. Thanks so much for joining me on this explainer.